Have you ever caught yourself clearing your throat again and again, even though you weren't sick? Maybe it happens first thing in the morning. Maybe it starts halfway through a conversation, or while you're driving, reading, or trying to enjoy dinner with your family. You swallow, cough lightly, sip a little water, and for a moment, it feels better. Then the sensation comes right back. Many people assume it's just part of getting older, seasonal allergies, or a lingering cold. But in many cases, none of those explanations tell the whole story. What's surprising is that some of the most common causes of persistent throat mucus have very little to do with an infection. In fact, many adults spend months treating the wrong problem. They buy cough syrup, suck on throat lozenges, or even ask for antibiotics, yet nothing seems to change. That's because the feeling of mucus in the throat is often a symptom, not the condition itself. Your body is trying to tell you something, but understanding what it's saying takes a closer look at how the throat actually works. If you're over the age of 40, this topic becomes even more important. As the body changes with age, the systems that quietly protect your airways don't always work as efficiently as they once did. Small changes that would have gone unnoticed years earlier can become daily annoyances. The good news is that many of these problems can be managed once the real cause is identified. The challenge is knowing where to look. Take someone like Michael, a 58-year-old accountant. Every morning started the same way. Before his first cup of coffee, he felt as though something was stuck in the back of his throat. He cleared it repeatedly while getting ready for work, during his commute, and even in the middle of meetings. Friends assumed he had allergies. He wasn't convinced. He never had a runny nose, fever, or other signs of illness. When he finally brought it up during a routine checkup, he was surprised to learn that several different conditions, not just one, could produce exactly the same symptom. That is one of the biggest misconceptions surrounding throat mucus. People often expect a single cause with a single solution. In reality, your throat sits at the intersection of your breathing, digestion, and immune systems. A problem affecting any one of those systems can leave you with the same uncomfortable feeling. That's why two people can describe identical symptoms yet need completely different approaches. Before exploring those causes, it helps to understand something that most of us rarely think about. Your body produces mucus every day, whether you're healthy or not. That may sound unpleasant, but it's actually a sign that your protective defenses are doing exactly what they were designed to do. Mucus coats the lining of your nose, throat, and airways, trapping dust, bacteria, viruses, and tiny airborne particles before they reach more delicate tissues. It also keeps those tissues moist, making it easier to breathe, speak, and swallow comfortably. Without mucus, every breath would expose your airways to constant irritation. The goal isn't to eliminate mucus altogether. The goal is balance. When that balance changes, either because your body makes more mucus, the mucus becomes thicker, or it doesn't clear efficiently, you become much more aware of it. That's when people begin saying things like, "It feels like something is stuck in my throat," even though no physical blockage is actually there. One common mistake is assuming that thicker mucus always means your body is producing too much of it. That's not necessarily true. Sometimes the amount is perfectly normal, but it's no longer moving the way it should. Other times, the throat becomes more sensitive, so even a normal amount of mucus feels irritating. Distinguishing between those possibilities is one reason healthcare providers often ask detailed questions about your symptoms instead of focusing only on your throat. As we continue, You'll discover why one of the most important cleaning systems inside your airways gradually changes with age, how those changes affect millions of adults without them realizing it, and why understanding this tiny, nearly invisible part of the body may completely change the way you think about persistent throat mucus.
Deep inside your airways, there's a cleaning system that's working every second of the day without asking for your attention. Most people have never heard of it, yet it plays a major role in whether your throat feels clear or constantly irritated. The lining of your nose, sinuses, windpipe, and larger airways is covered with millions of microscopic, hair-like structures called cilia. They're far too small to see with the naked eye, but together they perform an extraordinary task. They move in a smooth, coordinated rhythm, almost like a field of wheat swaying in the wind. With each tiny movement, they gently push mucus upward toward the back of the throat, where it's swallowed naturally. Most of the time, this happens so efficiently that you never notice it. In a healthy adult, this process runs around the clock. While you're sleeping, working in the yard, shopping for groceries, or enjoying dinner with your family, your airways are constantly trapping dust, pollen, bacteria, and other tiny particles. The mucus captures them, and the cilia quietly carry everything away before those particles can settle deeper into the lungs. As we get older, however, this system doesn't always operate with the same efficiency. Aging affects many parts of the body, and the airways are no exception. Research suggests that the movement of these microscopic cilia may become less effective over time in some older adults. That doesn't mean they suddenly stop working, but even a gradual slowdown can allow mucus to linger longer than it once did. When mucus remains in the throat, instead of being cleared efficiently, it becomes much more noticeable. This helps explain why many adults begin noticing throat symptoms in their 50s or 60s, even if they've never struggled with them before. It's not simply because you're getting older. Rather, age-related changes can make the throat more sensitive to issues that were once barely noticeable, such as mild dehydration, seasonal allergies, dry indoor air, or even a night of poor sleep. Think about what often happens during the winter months. The heater runs for hours, indoor air becomes dry, and many people drink less water than they should because they don't feel as thirsty as they do in the summer. Those seemingly small changes can make mucus thicker. Thick mucus is harder for the cilia to move, so it spends more time resting against the back of the throat. The result is that familiar feeling that something needs to be cleared away. Ironically, the natural response can make things worse. The more frequently you clear your throat, the more you irritate its delicate lining. That irritation can trigger even more throat clearing, creating a frustrating cycle. Many ear, nose, and throat specialists encourage patients to avoid habitual throat clearing when possible, not because the symptom isn't real, but because constant clearing can prolong irritation. Taking a sip of water or swallowing gently may be a better alternative for some people, depending on the underlying cause. Another common belief is that drinking ice-cold water or taking cough drops will solve the problem. They may provide temporary relief for some people, but if the real issue involves slower mucus clearance, postnasal drip, or irritation from another source, those quick fixes are unlikely to provide lasting improvement. That raises an important question. If aging and thicker mucus explain only part of the story, why do so many people with completely normal-looking throats continue to experience the same symptoms day after day? One answer is hidden much lower in the body, in a place most people never think to blame. In fact, one of the most common reasons for persistent throat mucus often begins in the stomach, even in people who have never experienced heartburn. That's where the story becomes even more interesting. For many people, the next discovery comes as a complete surprise. They visit an ear, nose, and throat specialist because they're convinced the problem starts in the throat. Their examination looks normal. There's no infection, no obvious swelling, and sometimes no clear explanation at all. yet the symptoms continue. That's often the point where another possibility enters the conversation, one that begins much lower in the body. The condition is called laryngopharyngeal reflux, or LPR. You may also hear it referred to as silent reflux. Despite the name, it isn't silent because nothing is happening. It's called silent because many people never experience the classic symptom of acid reflux, heartburn. Without that familiar burning feeling in the chest, it's easy to overlook the stomach as the source of a throat problem. To understand why this happens, picture your stomach as a carefully controlled environment filled with powerful digestive acid. That acid is essential. It helps break down food and destroys many harmful microorganisms before they can travel farther into the digestive system. Normally, a ring of muscle at the top of the stomach acts like a one-way valve, helping keep stomach contents where they belong. Sometimes, however, small amounts of stomach contents can travel upward into the esophagus. In certain people, tiny amounts may even reach the voice box and throat. Unlike the stomach, those tissues aren't designed to handle repeated exposure to digestive acid or digestive enzymes. Even small amounts can cause irritation over time. The body's response is actually protective. When delicate tissues become irritated, they often produce more mucus to create a barrier between the irritated surface and whatever is causing the irritation. That's why some people with silent reflux don't complain about heartburn at all. Instead, they notice frequent throat clearing, a hoarse voice that seems worse in the morning, a persistent cough, or the feeling that something is stuck in the throat, even though swallowing food isn't difficult. Consider Linda, a retired elementary school teacher. For nearly a year, she believed seasonal allergies were responsible for her constant throat clearing. She tried different over-the-counter allergy medications with little improvement. It wasn't until her healthcare provider asked detailed questions about her evening routine that a different pattern emerged. She often ate dinner around 8 o'clock, enjoyed a snack while watching television, and went to bed less than an hour later. That information didn't automatically confirm silent reflux, but it suggested another possibility worth exploring. This illustrates an important point. No single symptom can diagnose LPR. Healthcare professionals look at the overall picture, including symptoms, medical history, and sometimes additional testing when necessary. Persistent throat problems can have many causes, so it's important not to assume reflux is always responsible simply because it sounds familiar. Even so, certain everyday habits are known to increase the likelihood of reflux in some people. Large evening meals, lying down shortly after eating, excess body weight, smoking, and certain foods or beverages can contribute for some individuals. The specific triggers vary widely. One person may notice symptoms after spicy foods, while another may be more affected by large portions than by any particular ingredient. This is also where misinformation can become confusing. It's common to see claims online suggesting that every case of throat mucus is caused by acid reflux, or that one special food can cure it overnight. Neither claim is supported by good medical evidence. For some people, reflux is a major factor. For others, it isn't involved at all. That's why lasting improvement usually begins with identifying the correct cause rather than chasing quick fixes. And reflux isn't the only hidden explanation. Another possibility may already be sitting in your medicine cabinet. Some commonly prescribed medications can contribute to throat irritation or chronic coughing without people realizing there's a connection. Understanding that link can make all the difference before trying another home remedy that was never designed to solve the real problem. Many people are surprised when their healthcare provider asks them to review their medication list during an appointment for persistent throat symptoms. At first, the connection doesn't seem obvious. After all, if you're taking medicine for high blood pressure, heart disease, or another chronic condition, why would it affect your throat? The answer lies in the way some medications interact with the body's natural protective systems. One of the best-known examples involves a group of blood pressure medications called ACE inhibitors. These medicines are widely prescribed in the United States because they help protect the heart and kidneys in many patients. They are safe and effective for countless people, but like all medications, they can have side effects. One of the most recognized is a persistent, dry cough that develops in a small percentage of people. The cough may begin weeks or even months after starting the medication, making it difficult to connect the two. When someone coughs repeatedly throughout the day, the throat is exposed to constant mechanical irritation. Over time, that irritation can create a lingering tickle, frequent throat clearing, or the sensation that mucus is always sitting at the back of the throat. In many cases, the mucus itself isn't the primary problem. Instead, the throat has become increasingly sensitive because it's being irritated over and over again. Other medications can contribute in a different way. Some drugs, including certain antihistamines, antidepressants, and medications used to treat overactive bladder, may reduce saliva production in some people. Saliva does much more than keep your mouth comfortable. It helps lubricate the throat, supports swallowing, and assists the natural movement of mucus. When the mouth and throat become dry, mucus often feels thicker and more difficult to clear, even if your body isn't producing any extra mucus. This doesn't mean that everyone taking these medications will experience throat symptoms. Most people never do. It simply illustrates why healthcare providers look at the entire picture instead of focusing on one symptom in isolation. A medication that works perfectly for one person may produce side effects in another, and recognizing that possibility can prevent months of frustration. It's also important to remember that you should never stop a prescribed medication on your own because of throat symptoms. Conditions like high blood pressure, heart disease, and diabetes require careful management, and suddenly stopping treatment can have serious consequences. If you think a medication might be contributing to your symptoms, the safest approach is to discuss it with the healthcare professional who prescribed it. They can determine whether the medication is a likely cause and, if necessary, recommend a safer alternative. There's another area of growing scientific interest that's beginning to reshape how researchers think about respiratory health. It doesn't replace established medical explanations like allergies or reflux, but it does suggest that our digestive system may influence the health of our airways in ways we didn't fully appreciate years ago. Researchers often refer to this relationship as the gut-lung axis. The idea is that the trillions of bacteria living in our digestive tract interact with the immune system, which in turn may influence inflammation throughout the body, including the respiratory tract. This is an active area of research, and while the connection appears promising, scientists are still working to understand exactly how these relationships affect specific conditions. In other words, it's an evolving field, not a settled conclusion. Even so, one recommendation has remained remarkably consistent across major health organizations. A balanced eating pattern supports overall health, including digestive health. Diets that include plenty of vegetables, fruits, whole grains, beans, nuts, and other fiber-rich foods help nourish the beneficial bacteria that naturally live in the gut. Fermented foods such as yogurt or kefir may also fit into a healthy eating pattern for people who tolerate them well, although they aren't miracle cures for throat mucus. By this point, it becomes clear that persistent throat mucus rarely has one universal explanation. For some people, hydration makes the biggest difference. For others, treating reflux, reviewing medications, or managing allergies brings meaningful relief. The next question is the one almost everyone asks. What practical steps can you start today that are safe, realistic, and supported by good medical evidence? That's exactly where we'll turn next. Let's turn to the part most people are waiting for. If persistent throat mucus has been bothering you for weeks or months, what can you actually do about it? The encouraging news is that many evidence-based strategies don't involve expensive treatments or complicated routines. Instead, they focus on supporting the body's natural defenses and addressing the underlying cause rather than simply masking the symptom. One of the simplest places to start is hydration. It sounds almost too basic, yet it's one of the most important factors in keeping mucus at the right consistency. When your body has enough fluids, mucus remains thinner and easier for those tiny cilia to move out of the airways. If you're dehydrated, even mildly, the mucus can become thicker and stickier, making it much more noticeable. This is one reason many people wake up feeling worse in the morning after several hours without drinking water. Hydration isn't about forcing yourself to drink excessive amounts of water. For most healthy adults, it's more helpful to sip fluids consistently throughout the day than to drink several large glasses all at once. Water is an excellent choice, but other unsweetened beverages can also contribute to daily fluid intake. If you have heart failure, advanced kidney disease, or another condition requiring fluid restrictions, follow the guidance of your healthcare provider instead of increasing your fluid intake on your own. Now consider what happens inside your home. During the winter, heating systems often remove moisture from the air. In warmer climates, air conditioning can have a similar effect. Dry air doesn't necessarily increase mucus production, but it can dry the delicate lining of the nose and throat, making existing mucus feel thicker and more irritating. For some people, using a humidifier during dry seasons may improve comfort. If you use one, keeping it clean according to the manufacturer's instructions is essential because poorly maintained humidifiers can allow mold or bacteria to grow. If your symptoms are related to postnasal drip, another practical option may be a saline nasal rinse. Unlike medicated nasal sprays, saline simply uses a saltwater solution to help rinse away excess mucus, allergens, and irritants from the nasal passages. Many ear, nose, and throat specialists recommend saline irrigation for appropriate patients because it's generally well tolerated when used correctly. One important safety point, however, is that the water must be sterile, distilled, or previously boiled and cooled. Using untreated tap water in a nasal irrigation device is not considered safe because it can introduce harmful microorganisms. For people whose symptoms may be linked to silent reflux, everyday habits often matter just as much as medication. Finishing dinner at least 2 to 3 hours before lying down gives the stomach more time to empty before sleep. Smaller evening meals may also reduce pressure inside the stomach. Some people benefit from raising the head of the bed slightly, rather than simply adding extra pillows, which often bends the neck instead of elevating the upper body. These changes don't work for everyone, but they are commonly recommended as part of reflux management because they address the mechanics of how reflux occurs. Another habit that's easy to overlook is how quickly we eat. Busy schedules often mean lunch is finished in 10 minutes between meetings, or dinner is eaten while watching television. Eating too quickly can encourage larger bites and overeating before the brain has time to recognize fullness. Slowing down, chewing food thoroughly, and paying attention to portion size may support healthier digestion and may reduce reflux symptoms in some individuals. It's also worth taking a closer look at what you're drinking throughout the day. Excess alcohol can worsen reflux for some people, and too much caffeine may aggravate symptoms in certain individuals, although not everyone is affected in the same way. Rather than eliminating entire food groups unnecessarily, many healthcare providers encourage patients to notice personal patterns. Keeping a simple symptom diary for a week or two may reveal that certain meals, eating times, or habits are more important than any single food. Perhaps the most important takeaway is this: avoid the temptation to treat every episode of throat mucus with antibiotics or over-the-counter cough medicines. Unless a bacterial infection is actually present, antibiotics won't solve chronic throat mucus and may expose you to unnecessary side effects while contributing to antibiotic resistance. Lasting improvement usually comes from identifying the reason the symptom developed in the first place. Even with these practical strategies, there are times when persistent throat symptoms deserve prompt medical attention rather than continued self-care. Certain warning signs can signal a more serious problem,